And first of all, can I wish everyone a very happy new year. So if I could just, before I go over today's numbers, can I again just explain the changes that have occurred to the timing related to the reporting of COVID case numbers in Queensland. Some of you would be aware that in Queensland we report cases up to we have been reporting cases up to 7 a.m. A 24-hour period up to 7 a.m. Because of the large numbers of cases that we are now seeing in Queensland, as expected, it is becoming increasingly difficult for us to ensure that we have accurate data available for this press conference in the morning using that cut-off time of 7 a.m. So from today, we are changing our cut-off time to 7 p.m. That's last night, 7 p.m., the 24-hour period to 7 p.m. To give the time for the statisticians and data collectors to make sure that what you are receiving is accurate, given the large numbers of cases that we are seeing, to make sure there aren't duplicates, for example, that sort of thing. So today, the number you are seeing today, we're reporting today, is only for the 12-hour period from 7 a.m. yesterday until 7 p.m. yesterday. And the next number we will report will be a 24-hour period from 7 p.m. last night to 7 p.m. tonight. So the numbers so today is an aberration. It's only 12 hours worth of data, but from tomorrow we'll be seeing 24 hours worth of data. So it would look a little odd when you see the numbers come out. Okay, so as you've heard, cases as at 7 p.m. last night from 7 a.m. yesterday morning were 2,266. This looks like it's an increase based on what we observed in the preceding, in the 12-hour period on the preceding day, which was, I think, 1,613. But it will be easier to see this once we see these 24-hour periods. It brings the Queensland total to 16,125 and 13,959 cases are currently active. As of last night, we still had only one man in the intensive care unit of one of our hospitals, not on a ventilator, and I spoke to his doctors last night and he was improving. However, I'm also led to believe by doctors in hospitals that we are likely to see additional admissions to intensive care in this next 24-hour period. So even though the majority of people with COVID-19 have an illness like the flu, the majority of us, if and when we get it, will get an illness like the flu, there are still people that will get seriously ill when they acquire COVID-19. It's very critical. We mustn't underplay how severe this disease can be, and hence the need for the increased numbers, the increased use of masks in indoor spaces. We conducted 34,938 tests yesterday. There were 149 cases in hospital. It looks like we have a slight increase in the number of cases in the wards in hospital, of actually active infections in the hospital. Doctors report that they are treating 80 people in the wards for COVID-19. That number is a little bit more difficult to pin down and to ascertain accurately than the intensive care number, but there does appear to be an increasing demand in the wards for the treatment of COVID-19 as we move more and more people who are relatively well into alternative accommodation or into their homes when they have COVID-19. The state vaccination clinics administered 9,223 doses of vaccine, and more than half of the doses, I'm pleased to say, were boosters, which are critical, really critical, particularly for older people and people with the impaired immunity, also for healthcare workers. So please, if it's been 5 months since your last dose, then please go and get a booster, and from I think it's the 3rd of January, you can get it 4 months after your last dose. So as of the 30th of December, 90.67% of the 16+ population in Queensland had received 1 dose and 86.6% had received 2 doses.